Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4. We present about adult vaccination in Malaysia. We will focus on 5 important things about this topic. So first of all, I would like to introduce my group members and their part. For the first member is Shifana Zuha, will explain about health condition. And second presenter is Fatihah Nadia, will talk about international traveller. Next is Nur Shahida, will present about food handler, and Eliza Zin will explain regarding the healthcare worker. And finally, penalty enforcement to unvaccinated adult will be presented by me, Laila Rashika. The purpose of this discussion is to give awareness to people that vaccine is not only for small kids and children, but also for adults as well. As I said before, these are the main things that we'll be focused on, which is reason to have vaccine. The influenza vaccine, DPT vaccine, vaccine for individual that undergo splenectomy will covered under the health condition point. The meningococcal vaccine, yellow fever vaccine, explained under international traveller, while hepatitis B, MMR vaccine for healthcare worker, and the typhoid vaccine is for food handler.
Let's look on the vaccine that can be taken by adult due to health condition. First, influenza vaccine. This vaccine is given annually to high-risk group because of the emergence of new flu strains. Influenza virus may be transmitted among humans by direct contact with infected individual, by contact with fomites, and by inhalation of virus-laden aerosol. Influenza vaccine that available in Malaysia is called Vaccigroup. There is a list of people that need to get the influenza vaccine. The first target group is resident of institution for the elderly or the disabled. Second, the elderly with more than one of the following chronic condition: chronic cardiovascular disease, pulmonary disease, metabolic or renal disease, and immunocompromised person. Third, other individuals in the community who have these diseases. Fourth, those with regular frequent contact with the high-risk person. And fifth, large groups of pilgrims gathering in the same area for several weeks. Now, let's move on to the second vaccine, which is diphtheria, pertussis, and tetanus vaccine. The disease is caused by the bacteria Corynebacterium diphtheriae, Chordatella pertussis, and Clostridium tetani. It usually occurs primarily among unvaccinated or inadequately vaccinated individuals. The target group for DPT vaccine are as below. All adults lacking a completed primary series of diphtheria and tetanus toxoid should complete the series with TD. All adults for whom greater or equal to 10 years have elapsed since completion of their primary series or since their last booster dose should receive a dose of TD. Patients who have recovered from diphtheria should complete the full immunization schedules as the disease does not confer immunity. And all household and other close contacts due to it can be transmitted from person to person, usually through respiratory droplets, from coughing and sneezing. Next, we want to touch on the vaccination for individuals with splenectomy. The reason to having the vaccination is because the immunization against encapsulated bacterial pathogen will decrease the incidence of post-splenectomy sepsis. Below are the pathogens that cause post-splenectomy sepsis. The vaccine that need to be taken are polyvalent pneumococcus, meningococcus, and Haemophilus influenzae. These vaccines need to be given at least 2 weeks before splenectomy or soon after the surgery. Booster doses are recommended to be taken every 5 years for pneumococcus and 3 years for meningococcus.
The next part is about the international traveller vaccination. First thing first, the traveller should have considered about the requirement of the country that he wishes to travel. He can check with the relevant consulate or embassy. And then the traveller should have been planning well before start to travel, such as having a medical consultation, as by this he can update a few status such as his previous vaccination, his health status and risk factors, and then the vaccination that he might need based on the countries that he's going to visit, and so on. Okay, the first vaccine that are commonly related to the international traveler is yellow fever vaccine. This yellow fever disease is caused by the arbovirus that transmit via the bite of infective Aedes aegypti mosquitoes with the incubation period 3 to 6 days or longer. About this yellow fever vaccine, it is a type of live attenuated vaccine that are given with one priming dose of 0.5 ml, and it can be associated with few contraindications such as ache, allergy, immunodeficiency from medication, disease or symptomatic HIV infection, and so on. There's also could be adverse reactions that are rarely to occur, such as encephalitis or hepatic failure. And this vaccine is recommended to all travelers that wish to travel to the countries that are at risk of yellow fever transmission, such as African states, South and Central American states. And after the vaccination, we will be given like a yellow card or yellow certificate to confirm we have taken the vaccine and with the validity of lifelong. Second common vaccination with international traveler is the meningococcal vaccine. This meningococcal disease is caused by the Neisseria meningitidis bacteria, and there are many types of serogroups, but the pathogenic one that causes this disease is serogroups A, B, C, W135 and Y, and been transmitted via respiratory droplets or direct person-to-person contact with incubation periods 1 to 14 days. About the meningococcal vaccine, the risk for travelers is generally low, but different for the travelers, for the long-term travelers that are living in close contact with the indigenous population, and also for the pilgrims that are visiting Mecca for Hajj or Umrah. This meningococcal vaccine is considered as required vaccination by Saudi Arabia. They deem this vaccination as approved and as a visa requirement for pilgrims and guest workers to enter the country. And there are 3 types of vaccine that which under subunit type. The first one is conjugate meningococcal vaccine. They're given a single dose to individuals aged 2 years old and above, and by having one booster after 35 years old. And the second is the polysaccharide meningococcal vaccine with given 3 intramuscular doses with subsequent boosters, but it varies based on individual immunological status and age of the vaccinee. This both type of vaccine is the commonly used. The third is a combination vaccine based on Haemophilus influenza type B and Neisseria meningitidis serogroup C vaccine that are only recommended for some countries only.
Next is the vaccine for food handler. So the vaccine concerned under this category is typhoid vaccine. So before we go further about typhoid vaccine, I will briefly explain about typhoid fever. So typhoid fever is a serious disease. It is caused by bacteria called Salmonella typhi. So this typhoid fever causes a high fever, fatigue, weakness, stomach pains, headache, loss of appetite, and sometimes a rash. Some people who get typhoid become carriers and they can spread this disease to other people. So generally, people get typhoid from contaminated food or water. So this explains why food handlers should get typhoid vaccine to prevent them from spreading the disease to other people and prevent them from getting the disease first. Okay. So typhoid vaccine will give them some protection against the disease. It is about 50 to 55% effective. In food handlers, typhoid vaccine can prevent them from getting the disease and spread it to their customers, like I said before. So this typhoid vaccination is currently compulsory for all food and beverages in Malaysia. Okay, so under this Malaysian Food Act 1983,
and Food Hygiene Regulation 2009, all food handlers should get this typhoid vaccine. Food handlers should get typhoid vaccine. And how does this disease is spread to other people? Okay, like I said just now, we can get typhoid fever if we eat food or drink beverages that have been handled by the person who is shedding Salmonella typhi, or if the sewage is contaminated with Salmonella typhi bacteria, and then the sewage water gets into the water that you use for drinking or washing food. Okay, so this can cause the spreading of this disease. Once Salmonella typhi bacteria are eaten or drunk, they multiply and spread into our bloodstream. Okay, so our body will react with fever and other signs and symptoms, just like I mentioned in previous slide. So Salmonella typhi lives only in humans. So the person with typhoid fever carry the bacteria in their bloodstream and intestinal tract. In addition, a small number of persons called carriers recover from typhoid fever, but they can still continue to carry the bacteria. So both ill persons and carriers can shed Salmonella typhi in their feces. So that is why it is very important for food handlers to get this typhoid vaccine. There are two types of typhoid vaccine. We have live attenuated typhoid vaccine and inactivated or killed typhoid vaccine. So this live attenuated typhoid vaccine, or commonly known as oral typhoid vaccine, is given as a series of doses in capsule form. So there will be given 4 doses of the capsule form of vaccine. Okay, so this vaccine will be given to you to take at home. So the clinician will provide instructions on how to take the vaccine, and it is very important to follow the instructions. Okay, so this oral vaccine provides protection against typhoid for about 7 years, but provides the best protection up to 4 years. So if the worker wants to, if after 4 years, if the worker still want to continue to work in food and beverages industry, they should consider getting immunized again. Okay, so this oral typhoid vaccine should be given 2 weeks before they started the work to ensure the effectiveness of the vaccine. Okay, this vaccine also can causes some mild reaction to those who get the vaccine. Okay, for example, they will experience fever or headache, and also stomach pain, nausea, vomiting, and sometimes rashes. Okay, but this is very rare. Okay, so next is the inactivated killed typhoid vaccine. Okay, so for this vaccine, you will receive 1 dose of vaccine given by needle. Okay, so the injection vaccine provides protection against typhoid for about 2 years. So after 2 years, if the worker wants to continue to work in food and beverages industry, they should consider getting vaccinated again. Okay, so some mild reactions from this vaccine is fever, headache, redness, or swelling at the site of the injection. Okay, so to those who has had a severe reaction or allergy to a previous dose of this vaccine, they should consult your doctor, and they shouldn't get another dose of this vaccine. Okay.
Hi, I'm Ili. So we proceed the presentation with vaccine for healthcare workers. Healthcare workers such as physicians, nurses, pharmacists, and others are at risk for exposure to serious death disease. They work directly with patients or handle material that could spread the infection. If they get appropriate vaccine, they can reduce the chance to get spread vaccine preventable disease. This vaccine is to protect the patient, family members, and so on. In this presentation, we focus on 2 types of vaccine, which are hepatitis B vaccine and MMR vaccine. The first vaccine that I will present is hepatitis B vaccine. This vaccine usually given at birth and usually complete the series at 6 months of age. This vaccine given as 2, 3 or 4 shots. If we are 19 years of age, but not yet get vaccinated, we should get vaccinated. This vaccine is prevent us to get a disease called hepatitis B. Hepatitis B is a liver disease that can cause mild illness lasting a few weeks, or it can lead to a serious lifelong illness. There are two types of hepatitis B, which are acute hepatitis B infection and chronic hepatitis B infection. Acute hepatitis B infection is short-term illness. The symptoms are fever, fatigue, loss of appetite, nausea, vomiting, jaundice, and pain in the muscle, joints, and stomach. Chronic hepatitis B infection is long-term illness. The symptom of this disease is liver damage, liver cancer, and can lead to death. The second one is MMR vaccine. MMR stands for measles, mumps, and rubella. Adults who do not have presumptive evidence of immunity should get at least one dose of MMR vaccine. Certain adults may need 2 doses. Adults who are going to be in a setting that poses a high risk for measles or mumps transmission, such as healthcare workers, should make sure that they have had 2 doses separately by at least 28 days. Okay, now I will talk briefly about measles, mumps, and rubella. Okay, the first one is measles. Measles is one of the most transmissible of all human disease. Is caused by RNA virus. In this case, humans is a reservoir. This infection is one of the most deadly vaccine preventable disease. The complications include neurological, respiratory, ocular, and gastrointestinal. It may lead to death. The second one is mumps. Mumps is viral disease that target parotid salivary glands. The complications are encephalitis, meningitis, and pancreatitis. The third one is rubella. Rubella is contagious disease caused by virus. The person who had this infection may have mild illness with symptoms. The symptoms are low-grade fever, sore throat, and rashes.
I am Leila Rashika. So the last point is the penalty or enforcement to unvaccinated adults. These are some articles that I found regarding fine and issues about the unvaccinated people in Malaysia and also the other country. In Malaysia, there were currently no specific laws regarding immunization, especially to adults, but this should be mandatory for all children. Somehow, Ministry of Health will discuss with JAKIM to issue a fatwa requiring the injection. This is totally different with other countries such as United States. The unvaccinated adult who live or works in 4 zip codes within the area of the outbreak will be charged for $1,000 and the parents will face a violation and be subject to fine if they do not vaccinate their child. For me, I think our country should be more strict to this issue to reduce the burden of morbidity and mortality due to infectious disease among adults in Malaysia. Okay, I think that's all from us. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Don't forget to get vaccinated.